Have you ever noticed that as men get older, things just don't seem to flow the way they used to? Energy feels lower, stamina isn't the same, recovery takes longer, and circulation just doesn't feel as strong. Now here's the part most people don't realize. This isn't just getting older. There's something deeper happening at the cellular level, something that silently affects blood flow, performance, and overall vitality in aging men. And today, I'm going to explain something that almost no one is talking about, something surprisingly simple, yet incredibly powerful. It's bicarbonate, yes, that same compound most people associate with baking soda. But when you understand how bicarbonate works inside the body, especially in aging men, it can completely change the way you think about blood flow, energy, and long-term health. Stay with me, because by the end of this video, you're going to see blood circulation in a completely new way. Now, for those of you who are new here, my name is Dr. Nrina.MD, and on this channel we talk honestly and scientifically about health, fitness, and how the body really works as we age. And today, I want to talk to you like I would talk to a patient sitting across from me in my office. No hype, no gimmicks, just physiology, real-world application, and clarity. As men age, one of the most common issues I see is reduced blood flow, and this shows up in many different ways. Cold hands and feet, reduced endurance during workouts, slower recovery, mental fog, and yes, changes in sexual performance and urinary health. Blood flow is life. Every cell in your body depends on it. Oxygen, nutrients, hormone signaling, waste removal, all of it relies on healthy circulation. So when blood flow declines, everything downstream begins to suffer. Now here's the part most men don't hear about. Blood flow isn't just about your heart or your arteries being clogged. That's part of the picture, but it's not the whole story. Blood flow is also heavily influenced by something called pH balance, acid-base regulation, and how efficiently your blood vessels can relax and respond to demand. This is where bicarbonate enters the conversation. Bicarbonate is one of the body's most important buffering systems. Your body produces it naturally, and it plays a critical role in maintaining the proper pH of your blood. You see, your blood needs to stay within a very tight pH range. Too acidic or too alkaline, and your cells simply can't function properly. When the body becomes more acidic, which happens more easily as we age, blood vessels become less flexible. They don't dilate as easily. Oxygen delivery becomes less efficient, and blood flow starts to suffer. As men get older, several things happen that quietly push the body toward a more acidic internal environment. Muscle mass declines, which reduces metabolic buffering capacity. Kidney function slowly changes, making acid regulation less efficient. Diet often becomes more inflammatory, higher in processed foods and lower in minerals. Stress levels remain high. Sleep quality drops. All of these factors increase what we call metabolic acid load. When acid builds up in the bloodstream and tissues, the body has to neutralize it, and bicarbonate is one of the primary tools it uses to do that. But here's the issue. As men age, bicarbonate availability and buffering efficiency can decline. That means acid sticks around longer, especially during physical activity or stress, and that acidic environment directly affects blood flow. Let me explain how this works in simple terms. Blood vessels are lined with a thin layer of cells called the endothelium. This layer is responsible for signaling when a vessel should dilate and allow more blood to flow. One of the key molecules involved in this process is nitric oxide. Nitric oxide tells blood vessels to relax. It's essential for circulation, especially to muscles, the brain, and the pelvic region. Now here's the connection. Acidic conditions reduce nitric oxide availability. When the blood becomes more acidic, nitric oxide breaks down faster, and blood vessels lose their ability to relax fully. This leads to tighter vessels, reduced circulation, and increased blood pressure over time. Bicarbonate helps counteract this by buffering excess acid, restoring a more neutral pH, and protecting nitric oxide signaling. This is why bicarbonate has been studied extensively in sports medicine. Athletes have used bicarbonate for decades to improve endurance and delay fatigue. But what's often overlooked is how relevant this is for aging men, even those who are not elite athletes. Everyday activities like walking, climbing stairs, strength training, or even sexual activity rely on rapid blood flow and efficient oxygen delivery. When bicarbonate buffering is impaired, these activities feel harder than they should. Now, let's talk specifically about aging men and blood flow to critical areas like the pelvis and urinary system. Healthy blood flow to the pelvic region is essential for prostate health, bladder function, and sexual performance. Reduced circulation in this area is linked to urinary symptoms, erectile difficulties, and reduced sensitivity. And while medications exist, they don't address the underlying metabolic environment that's contributing to the problem. By improving bicarbonate buffering and supporting a healthier pH balance, blood vessels in the pelvic region can respond more effectively. This doesn't mean bicarbonate is a magic cure, but it does mean it supports one of the foundational mechanisms required for proper function. Blood vessels that can relax properly deliver more oxygen, more nutrients, and more hormonal signals to tissues that need them. Another important aspect to understand is how bicarbonate affects muscle fatigue and recovery. Aging men often notice that workouts feel harder than they used to, even when strength levels haven't dropped dramatically. Part of this is due to lactic acid accumulation and slower clearance. Bicarbonate helps neutralize excess hydrogen ions produced during exercise, which delays muscle fatigue and improves endurance. Better muscle performance means better circulation overall. When muscles contract efficiently, they act like pumps that help move blood back to the heart. This improves venous return, reduces pooling in the lower extremities, and supports cardiovascular health. Over time, this creates a positive feedback loop where better circulation supports more activity, and more activity supports better circulation. Now let's talk about the kidneys, because they play a major role in bicarbonate regulation. As men age, kidney efficiency gradually declines. This doesn't necessarily mean kidney disease, but it does mean acid excretion becomes less efficient. When the kidneys can't remove acid as effectively, bicarbonate levels drop and blood pH shifts slightly toward acidity. This subtle change can have widespread effects over years and decades. Research has shown that maintaining adequate bicarbonate levels is associated with better muscle mass preservation, improved bone health, and reduced inflammation in older adults. Inflammation, by the way, is another major enemy of blood flow. Chronic low-grade inflammation damages blood vessels, stiffens arteries, and impairs endothelial function. Bicarbonate indirectly helps reduce inflammation by stabilizing the internal environment of the body. Now, I want to be very clear here. I am not saying that men should start consuming large amounts of baking soda without guidance. That can be dangerous and inappropriate for certain individuals, especially those with high blood pressure, kidney disease, or on specific medications. What I am saying is that understanding bicarbonate's role opens the door to smarter nutritional and lifestyle strategies that support your body's natural buffering systems. One of the best ways to support bicarbonate levels naturally is through diet. Foods rich in potassium, magnesium, and calcium help the body produce and maintain bicarbonate. Fruits and vegetables, especially leafy greens, are alkaline-forming foods that reduce acid load. This doesn't mean you need to eliminate protein or exercise, but balance is key. A diet chronically high in acid-producing foods with little buffering capacity places extra strain on the body as it ages. Hydration also plays a major role. Dehydration concentrates acids in the blood and reduces the efficiency of buffering systems. Adequate water intake supports kidney function and acid excretion, which helps preserve bicarbonate levels. Many aging men are chronically underhydrated without realizing it, especially if they limit fluid intake due to urinary concerns. This can unintentionally worsen circulation issues. Stress management is another critical factor. Chronic stress increases acid production through hormonal pathways. Cortisol and adrenaline alter metabolism in ways that increase acid load. Deep breathing, sleep quality, and recovery practices all influence acid-base balance. Something as simple as slow diaphragmatic breathing improves carbon dioxide regulation, which directly impacts bicarbonate buffering. Physical activity, when done correctly, actually improves bicarbonate buffering. Physical activity, when done correctly, actually improves bicarbonate efficiency over time. Regular moderate exercise enhances mitochondrial function, improves acid handling, and strengthens the cardiovascular system. The key is avoiding excessive overtraining without recovery, which can overwhelm buffering systems and lead to chronic fatigue. Now let's address a question I often get. Can bicarbonate supplementation improve blood flow directly? The answer is nuanced. In controlled settings, bicarbonate supplementation has been shown to improve exercise performance, increase time to fatigue, and support vascular function. However, it must be used carefully and appropriately. The goal is not to artificially manipulate pH, but to support the body's ability to maintain balance. For aging men, the real value lies in understanding the mechanisms and addressing the root causes of declining buffering capacity. That means optimizing nutrition, hydration, kidney health, muscle mass, and cardiovascular fitness. When these systems are supported, bicarbonate does what it's designed to do: maintain an environment where blood vessels function optimally. And this brings us to the bigger picture. Blood flow isn't something you fix with one pill or one supplement. It's the result of thousands of processes working together. Bicarbonate is one piece of that puzzle, but it's a foundational one. When pH balance is off, everything else struggles to compensate. I've seen men in their 60s and 70s dramatically improve their circulation, energy, and quality of life, not by chasing quick fixes, but by addressing these underlying systems. Better blood flow means better workouts, sharper thinking, improved urinary function, and greater confidence. It means your body can respond when you ask something of it. So if you're an aging man, or if you care about one, I want you to start thinking differently about circulation. It's not just about cholesterol numbers or blood pressure readings. It's about how well your blood vessels can respond in real time. It's about whether your internal environment supports flexibility, oxygen delivery, and efficient signaling. Bicarbonate quietly supports all of that. It doesn't get the attention it deserves because it's not flashy. But in medicine, the most powerful systems are often the ones working silently in the background, maintaining balance, stability, and resilience. If you found this explanation helpful, I want you to stay tuned to this channel. We're going to continue breaking down complex health topics in a way that actually makes sense and helps you take control of your health as you age. And if you're someone who's noticed changes in your energy, circulation, or performance, know that aging doesn't mean decline is inevitable. It means your body needs smarter support. This is Dr. Nrina.MD, and I'll see you in the next video.